So this is an introduction, I think, what kind of drugs we sort of covered in the FLEX study. And Garrett asked me yesterday we should include all the legal stuff as well, so we included listed drugs in the talk, so that's tobacco, alcohol, erectile dysfunction medications, and steroids. So for tobacco use, I think nearly a third they never use tobacco in our study, and around 40% they are currently using, including 20% of the daily users. Now, for alcohol use, we have around close to 30% of who report a very low risk of alcohol consumption, and around a third they have sort of a high to severe alcohol sort of associated risk. So this graph, or these two graphs, shows you sort of what the context of tobacco use in our cohort. So as a cohort study to investigate the incidence and cessation of drug use, we targeted specifically a very young gay men. So in the end, we recruited about a quarter of men under the age of 25. So these four age groups, that's under 25, between 25 and 30, and between 30 and 40, those above 40 sort of years. So it's chosen roughly according to the sort of quartiles we had in our participants. And maybe the left sort of the left graph may alarm you. I think it's sort of nearly sort of 50% of the young gay men sort of under the age of 25 in our study, they reported using tobacco in the last 6 months. But put that into perspective, and we can see from the graph on the right, most of the young men they used they smoked tobacco very sort of occasionally, so they reported once or twice in the last 6 months. And for those men aged above 40, I think most current smokers they smoked daily almost. And for steroids, I think very few men used steroids in our study. So in the last 6 months, about 1.5% they reported steroids use. And for erectile dysfunctional medications, that's sort of Viagra and some others, I think 2/3 never used, and 10% they used. Also, its previous use, and around another 20% they used currently in the last 6 months. So let's move on to those serious stuff. So this analysis was based on those nearly 2,000 men who consented to the follow-up part of the FLEX study. And for almost every drug, we collected prevalence for sort of 4 indicators, sort of those who ever used and those who ever injected. And for those who reported using in the last 6 months, we also collected the prevalence of recent use and recent injection as well. So for those 10 drugs, and we can find from the blue bar. So the most common drug ever used in our cohort is marijuana, followed by amyl. And about 30% of men in our study reported ever using crystal meth. And the green bar shows those who reported current use in the last 6 months. And then we can see that sort of has shifted a little bit. So the amyl was the most commonly used drug currently, and then followed by marijuana. And around 15% of men they reported using crystal meth in the last 6 months. So this graph shows you sort of a proportion of those men who reported recent use in the last 6 months in proportion to those who reported ever using these drugs. And for amyl, it's about 50% of them who reported ever using amyl, they are using it currently or in the last 6 months. And as a comparison, you can see for crystal meth, I think it's about 45% of the men for crystal, if they ever used crystal, they are using it currently. Now this graph shows you the frequency of drug use in the last 6 months. And first of all, we can see from the blue sort of color, so for almost all the drugs, if men reported using these drugs in the last 6 months, most of them, more than half, they reported using sort of occasionally rather than sort of frequently. So for AML, so that's about 50% they're using occasionally, and this is followed by crystal. I think it's around 45% or to 50% as well. They are using the drugs occasionally, and the yellow color indicates daily use, so that's most frequently associated with marijuana use, and followed by crystal use. And I apologize for this very busy graph. It almost looks like a barcode. But this essentially it's the same graph as the previous one, but for each of the drugs, we just broke down to 4 age groups, so which shows you the distinctive trend associated with the patterns of drug use and in association with the age. And then we can see here the two patterns emerged, I think, for AML, and to a less extent, the special case, it's more favored in older gay men. So older men, they reported using it more frequently. And for ecstasy and GHB, that's it's more popular in younger gay men. So the younger gay men, if they reported using it currently, they tend to use it more frequently compared with older men. So there's a proportion of ever injected these drugs, so in proportion to those ever used, and we can see very few men for injectable drugs, very few men reported injecting use of these drugs. But I think in this slide, crystal meth stands out. Around 25% of men who reported ever using crystal, they ever injected as well. So this looks at current users. Further I think that's crystal meth. So that the proportion is even increased. So around 30% of the men, if they reported using crystal meth in the last 6 months, I think they reported also injecting use of crystal meth. So in conclusion, marijuana. We found in the FLUX study, marijuana was the most common ever used drug, and currently, if you refer to the last 6 months, AML was the most common recently used drug, and most of those drug use were occasional use. And I think we also found injecting use of marijuana consists of a substantial proportion, but still it's a minority if they for ever use and recent use. That's the end.